Hi, my name is Kiran Agarwal-Harding from the Harvard Global Orthopedics Collaborative.
My name is Leonard Banza, Chief Orthopedics at Kamuzu Central Hospital here in Malawi. Malawi is a small country in the southern Africa with a population of 18 million. 85% of the population live in the rural areas and 51% live in poverty. I am one of the 12 orthopedic surgeons working in Malawi. As a result, orthopedic care is provided by orthopedic clinic officers or OCOs. These are non-physician clinicians trained in non-operative fracture management. They are able to perform close reduction, casting and splitting of the fractures, but also they are able to refer patients who need surgery to a surgeon like myself in a central referral hospital. So this whole project came in while Kiran was visiting Malawi, and I was operating with him. We were operating on a middle-aged man who had a tromalolar ankle fracture and who was referred to us 5 weeks after the injuries. So when we saw this patient, the ankle was still subluxed and it was not even splinted.
Yes, and I remember that case vividly. It suggested that there were significant challenges in managing ankle fracture in Malawi. Why had the patient not undergone a closed reduction or been immobilized? Why did it take the patient 5 weeks to present at the central hospital with an injury that clearly needed surgery? From previous studies, we already knew that no public hospitals in Malawi have the minimum required resources to provide adequate fracture care. So in that context, we wanted to know how are ankle fractures managed in Malawi and what are the barriers to care? So to answer these questions, we assessed Malawian providers' knowledge of ankle fracture anatomy, diagnosis, and treatment principles. We asked providers to share reasons why they may not always be able to provide the ideal treatment to their patients. And we observed providers' actual treatment practices in the hospital. We found significant knowledge deficits among Malawian orthopedic providers and an apparent lack of treatment standardization. And we found that many patients with ankle fractures that would benefit from surgery were being treated non-operatively, in part due to resource limitations, but in part due to lack of provider knowledge.
So we designed an educational course to refresh Malawian providers on key clinical knowledge, update providers on evidence-based treatment principle, and present a standardized protocol that will be feasible within the context of limited resources here in Malawi.